Good afternoon, ladies and gentlemen. I'd now like to start the public program to talk about the COVID-19 to visit the physical activity. I am Inoue from Tokyo. I am Oguma. I am from the Sports Medical Department, Keio University. Thank you very much for your participation. First of all, I will ask Professor Oguma to talk about the background of today's symposium. Let me talk about the today's background. Dr. Fiona is in Geneva, and we have Commissioner Suzuki. We have some common points. One of them is to increase the people who are interested in physical activities and sports, so that would contribute to the increase of the health among all the people. And today we will listen to the lecture by Fiona, and she will talk about the Global Action Plan on Physical Activity that was issued in 2018. And then she says that the promotion of physical activity would help to achieve the 13 goals out of the 17 SDGs. And also, Commissioner Suzuki will talk about the sports initiative, and also we will talk about the legacy of the Olympic and the Paralympic Games. And Dr. Inoue is one of the directors of the Japan Association Exercise Epidemiology, and I am also a member of the same association. And originally, we were to invite Fiona to come to Yokohama to give us a lecture on the 12th on site, but because of the COVID, we couldn't make it. But we learned that there were so many collaboration between the sport and health sectors, and also in Japan, the collaboration between Japan Sports Agency and the Japan Medical Association. So we wanted to realize the live discourse between WHO and the Japan Sports Agency. And then we asked the committee of the organizing committee of 2020 Yokohama Sports Conference, and then we were able to have this live lectures inviting Fiona and Commissioner Suzuki. We are very much grateful for this opportunity. Now we would start the public program using Zoom. So if you have any questions, please write your questions on chat, and then so that we can listen to your opinions. And also the presentation is all prepared in Japanese, and then in the chat we can send you some URL of the Japanese versions of those slides, and hope that would help your future reading. Also, we have a simultaneous interpretation today, so you can choose either English or Japanese by pressing the button on the Zoom screen. That is the housekeeping communication message, and I'd like to ask Fiona to start the presentation. So first of all, I would like to introduce Fiona Bull, Dr. Fiona Bull. She is now at the head of Unit Physical Activity at the World Health Organization. And today she will talk about the Global Action Plan on the Physical Activity, and also the WHO's new guideline on physical activity. She's promoting all of those exercises, and she is now leading all the activities related to the physical activities throughout the world. She is, of course, a researcher, and she has written so many publications, articles, and of course, all of those activities were well recognized, and she was given an award by the British government. And then I'm sure she is promoting lots of policies on the basis of the reality, and that is very encouraging. And many Japanese scholars and practitioners have a very good relationship with Dr. Fiona Bull, and then I think she is very much expecting lots of a lot from a Japanese side as well. So the floor is yours, Dr.
Thank you very much. And a very good morning to you all from Geneva. I will share my screen to bring up my PowerPoint. Can I confirm from the chair that my slides are visible, please?
Yes.
Thank you very much. And a very good morning. Appreciations to Commissioner Dr. Suzuki, to the organizer, Dr. Oguma, and colleagues at the Society, and to the virtual audience joining today for this session. From WHO, physical activity has never been more important, and I'm very pleased to, over the next 30 minutes, outline why physical activity is important, reminding some of you and introducing to others that it's not just a sport or a health issue, it's a societal and important issue for everyone. I'd like to introduce and expand on the global action plan of what we can do in collaboration and together to promote physical activity. We have the realities of COVID, and so I will speak to some of the challenges and changes that have happened this year and how we can use some of the opportunities to forward our shared agenda. And I'll finish talking about how important in the world of collaborations it is for sport and health to have the very best and the very most productive relationship. The first section of my presentation is looking at the benefits and reminding you on the left, there is an enormous body of science, much of it from Japan and elsewhere, showing that physical activity, higher levels of physical activity, provide benefits for everyone. Very important medical journals, special populations and reports, and WHO have confirmed this evidence. And we're currently updating that. And in 2020, we'll be releasing new guidelines that will again confirm a new opportunity for us. I'll speak more on this. The graph on the right is reminding us that any physical activity is better than none, that we do aim to promote a range of activity, 150 minutes, 2.5 hours a day for adults, a week for adults, provides enormous health benefit, and we know more is better. And we know there are some who do very high levels of activity. But the focus of WHO, and I think all of us, is we want sport for everyone, physical activity for everyone regularly, and the benefits. Now, this graph could have been shown with cardiovascular disease, with the prevention of diabetes, with the reduction of risk of cancer, many, many diseases, improvement of mental health. But let me focus in particular on the areas where we know we can prevent some of the leading causes of disease. These are the percentage we could avoid. And in total, up to 5 million deaths a year if we were more active at the recommended levels. So our task is to collaborate to avoid these preventable deaths. And that's very much at the center of the Sustainable Development Goals, particularly Target 3.4, which I'm sure many of you are familiar with, but we see physical activity connecting with many of the other targets shown on this slide. Improving cities, sustainable transport, better education, improving learning, better equity for girls and boys, men and women, younger and older adults to enjoy sport and being active every day. This is a global priority because 3/4 of deaths are due to non-communicable disease. I know we're hearing a lot about COVID, and we hear a lot about other communicable diseases, malaria, tuberculosis. But the facts are we're more likely to die of non-communicable disease. And this is true in middle income and low income, as well as high income. We can prevent and reduce these numbers. But the numbers on physical activity show that currently 1/4 of adults do not meet that threshold I showed. And more worryingly, 3/4 of adolescents in their very early years, the early transformative years of 10 to 15, 18, and they are dropping out of sport and physical activity. Looking at those adult data in a little more detail and over time, we see a difference between men and women, women in green, men in blue. But the most strongest message this slide shows is no change. It's been around about 1/4 of men and 1/3 of women not meeting the activity recommendations for the last 15 odd years. We must do better to reduce that gap. We must work in collaboration and prioritize promoting physical activity to girls and women. And we must overall reduce that level to much lower. Our target, as you will see, is a 15% improvement. Here we see the differences by regions, and we can see that in the South, the Latin America and Caribbean on the left, the high-income Western and high-income Asian, like Japan, have the highest levels. And again, you see that gender gap quite pronounced in these regions. We can also look at over time and by those regions, and we see in the center, high-income Asia is not only some of the highest region, but also it's flat. Worryingly, in Europe, we see it rising. In Latin America, we see it rising. And in other regions, very few regions, we see it falling. So our challenge globally is to understand the local and respond to where and what is needed. Looking even closer very quickly, we see where Japan is in the region, the WHO region of West Pacific. Again, it's in the middle. It's not the leader, but it's not at the bottom end. So we need to work in Japan and the region and globally. This pattern within regions is similar in West Pacific to also in Europe. The countries don't matter. I'm showing you that we have variations nearly up to half of the population being less active than health benefits would require. Lastly, it is the high income where we see the most concerning rise. Lifestyles are changing in how long we work, how we travel, how we recreate, less sport and more screens. We have to change this. We need a shift, a paradigm shift, and we must collaborate to achieve this. For boys and girls, I've shown you earlier that it's up to 3/4 and the trend is also flat. So I show the audience, what is the future? Will it be a flat line continuing? Or can we have a major change? Collaborate and work together through sport, through health, through education, through communities to make those lines start going down. That's our challenge. And the challenge was set for WHO to create a new global action plan. We did this and launched in 2018, and I'm very pleased and wish to thank the organisers and the society for translating this into Japanese. It sets the goal of 15% improvement by 2030, and it speaks specifically to promoting the ways we can be active. Regularly walking and cycling, playing sport, competitive or recreationally, dance and play, all are the ways we can be active. The Director General of the World Health Organization launched this on the right. We must get the world moving. But he also noted it will take political commitment and action and collaboration from all sectors. This is not just a sport issue. It's through sport and through the power of sport we can create and engage. It's not just a health issue, but health is part of the solution, and WHO is here to provide that support. Very briefly, there are 4 areas of action, and despite COVID, they remain relevant, indeed vital at this time. I'm going to briefly go through these with some examples. The first area in red, the top left, is about creating new norms, changing societal views that you don't need to be active as you get older, that activity and sport is for young people or fit people. We need to do education programs. I would like to see big education, communication through Japan's community. And the Olympics and the Olympic movement is a lovely partnership where we can do this. This slide shows examples from elsewhere. Very recently in France, in India, in Jamaica. These are led by senior politicians and the government as a collective. We know more information, regular information in vital and vibrant ways will be important for physical activity or for specific types. So we can do cycling promotion, and there are many, many countries doing this. We can do walking promotion. We have to understand why people aren't and promote the benefits and reduce the barriers. But campaigns are a central pillar. But it's not enough to tell and to motivate. We have to enable. We have to create environments and the places people are active that are safe and convenient. We know cities can be designed and redesigned to be better places. Europe is famous for some of the cities where walking and cycling are particularly strong. We have to balance this so that we have good mobility systems with public transport, walking and cycling as the core modalities. The car has driven, literally, the design of cities that are making walking and cycling less comfortable, less safe, and less desirable. We can use spaces, opening them up for streets, opening the streets up for recreation and play. This is Bogota, 170 kilometers every Sunday around the whole city. You can do smaller amounts, but this is a role model, designing cities, parks and places for being active. But that is not enough. We now have to invite people and engage people through the different settings where we work, live and play, and targeting the people who need to be active the most because they're currently least active. In the workplace, encouraging people to sit less and move more, encouraging breaks at lunchtime for a walk, encouraging the use of stairs, of course, with social distancing, with protective and masks when this is now needed. In schools, the physical education program, the sports program for all, not just competitive. In childcare, that they're active in those hours, not only sitting or sleeping. And I've mentioned prioritizing girls and women and people with disabilities. We know the solutions, and I know my colleague, Dr. Suzuki, will be sharing many of these. We need to implement these actions everywhere, and that's the collaboration we need. So everyone in all countries, all ages, and all abilities are finding what they enjoy to do regularly. And lastly, we need to make sure the systems work, the research, the science, the civil societies, but also the government, the national policies and action plan, the surveillance systems that are measuring and monitoring progress and providing feedback, the targets so we are accountable, and the workforce development, because the collaborations can only start if we all understand and are working together. So coordinating and engaging through coordinating mechanisms, not just around health, but with all sectors. And when you bring these 4 areas together, you have a system, an ecosystem that can work proactively and complement and synergies. The education and promotion campaign is linked to the programs in schools and healthcare, the advice a doctor gives a patient, and the parents receive and hear from schools and children, and the environments are providing the places, and the targets and government are ensuring things happen. This is the systems or whole of community approach to create a more active world in Japan and globally. WHO has a big task because to help countries like Japan implement these ideas, implement the Global Action Plan in your own national strategy, your own strategies towards achieving the SDGs, your own strategies on sport, we've identified 10 areas. I won't be able to talk about all of them, but certainly you see on the top left, partnerships and collaborations. Let me show you just 3 of these areas in more detail. I mentioned at the beginning, we are updating the guidelines. This provides a new opportunity to remind everyone in government, in civil society about the importance of physical activity. It really does matter. I want to introduce that we have 3 new guidelines coming out, not just the 3 age groups, but also guidelines on chronic disease, people living with hypertension, diabetes, HIV. We have guidelines on pregnancy and postpartum for the first time, and guidelines on the importance of physical activity for people living with disability. We address physical activity and sedentary behaviours, and these guidelines are due for launch in late November. I hope Japan will engage with us to ensure that your translated version of the Global Action Plan and your work in Japan can use these new guidelines. We're collaborating with many to use and innovate digital technology strategies. We know the phone is in most people's pocket, if not their hand, or very close by throughout the day. The idea is that we can use the phone to remind people to sit less and move more, to be active regularly, to provide the programs, as we have seen so much innovation through the COVID response. We're working on M-Active, and we would like more collaboration with sport and with countries to scale this developmental project and implement it in countries and communities. And my third area, the third action we're leading on, is evaluation and monitoring. You will want to know, how are we doing with this global action plan? And we have developed a monitoring framework where we take on the left the objectives I've introduced, the actions that are very clearly laid out in the action plan, and we're identifying the indicators of process, of outcome, and of course, of impact on levels of physical activity overall. More specifically, you see in this slide, the same pattern, the objectives on the left, more details of some I have illustrated in the middle, and we are identifying a set of global indicators. Have you got PE in school for girls and boys from 5 years through to 18? Is it legislated? Is it delivered? Have you got targets for walking? Have you got targets for the modal share of cycling? Have you got legislation reducing speed to make environments safer? These are examples. And we need sports policies on sport for all, and we need targets to ensure that we are creating the environments and opportunities. WHO and the world will be judged by achieving the overall impact on levels of physical activity in adults and adolescents and reducing those inequalities. So it's those graphs at the start of my presentation. We want to change the direction of those data. COVID, it has changed our world in profound ways. Some of them are negative. We've been told to stay at home, so our regular routines are disrupted. The places we're active have closed. The clubs and recreation, the fitness, the gyms, this is having an economic and a health consequence in the area of physical activity, even the public open spaces. And yet, on the other hand, people are choosing, with sometimes more time, to now walk more. Cities are creating cycle lanes. So there are opportunities as we deal with these challenges. WHO has been very busy making sure with our colleagues in the IOC that we work on healthy messages. Being active in the home is new for many of us, the majority of us. So we need innovation from the sports community, from the sports trainers, from all that can help to help us be active around the home. We need to ensure that governments understand that physical activity is core to some of the underlying conditions that make people vulnerable for more severe experience of COVID. We also need to help the industry and sports return to the new normal or return better with more opportunities in new ways, online and in person and in different places. This slide presents some of the issues. I've spoken to some of them. We can increase working collaboratively with sport, health and cities to promote walking and cycling, ensuring children can get to the places they can be active. We must work to ensure schools continue to provide physical education and physical activity opportunities through educational experiences, whether that's at home or at school premises. Parks, we want to reopen and re-engage in new ways. There's lovely examples across Asia and in Japan using public space better. And that's where some of Europe and North America can learn from experience in Asia, where facilities for older people, Tai Chi and yoga are done in the open spaces. And that's good for safe COVID responses as well. We need to learn from COVID. There are research needs. We need to now work on the rehabilitation of COVID patients who've experienced COVID, and we need to build back better. WHO has created some materials. These are available from our website. And we are working in collaboration with sport. I show you here the very enjoyable celebration with the president of the IOC and the Director General of the World Health Organization. And we have worked out 5 areas to work on where there's joint collaboration and synergy. The communication with the reach and power of sport, the athletes, the visibility, the Olympic movement, the youth games, the Olympic games. These are opportunities for clear and joint communications. To make sure the policies in sport are aligning, the policies around disabilities, around the levels of activity, sport for all. This is a policy alignment agenda. We need to work in the opportunities that the legacy of the Olympic Games has, and of course in health and security preparedness. I'm particularly interested in the opportunities of Japan and the Tokyo Olympics around the legacy. I think we can strengthen the work of legacy so we leave more active nations and we leave a better place for physical activity for the communities across Japan and the world. We need to strengthen the promotion that all of the players and the international sports federations play in the Olympic movement. And of course, strengthen and support on all of the areas I've introduced around the Global Action Plan on Physical Activity, whether that is the target setting, the workforce development, the research agenda. There are many opportunities and we must work together to do these. The collaboration and the coherence will be how we will make more change, not working as we have too much in the past separately. I finish again that overall we all share the goal towards the Sustainable Development Goals, but to realize the benefit of sport, to realize the opportunity and contribution of physical activity, we will have to get started and move into implementation at scale in countries. That will need political leadership, visibility that sport can bring, and the voice of sport and health together. So in summary, physical activity is so important for our health individually, for our health of a community. And by being active, for example, through walking and cycling, we can help the environment and also the economy because we're walking in smaller local communities. Win-win, win-win. The action plan does show what we need to do. Evidence-based, globally developed, ready to implement. We need to collaborate on a whole of system. One thing alone, 2 things is not enough, but we have the agenda and I think we have the motivation and the right time to work on it. I've mentioned partnership and I won't say it and repeat it, it's there again, but it is the partnership that will deliver impact. And let us view and discuss the opportunities of this moment in time as well as the challenges. Thank you very much, and I hand back to the chair.
Thank you, Fiona. Thank you very much. So the current situation and effect of physical activity, and also the new action plan, collaboration with IOC, and promotion of physical activity relating to the achievement of SDG goals. You mentioned all those, and also gave us take-home messages. The importance of partnership is particularly emphasized, and I took that as very important. We will have Q&A session at the end of the proceeding today. But for now, We'll proceed to the next presentation. And, I'd like to introduce our speaker, Daichi Suzuki, Commissioner of the Sports Agency of Japan. Everybody knows him, but he is an Olympian athlete. In 1988 in Seoul Olympics, he won the gold medal in backstroke swimming. I can still remember the image of that day, at that moment. But he's also a research and educator as well. In 2007, he received a PhD in medicine from Juntendo University. In 2013, he has been teaching at the Juntendo University, science coaching. Also, he's a member of the Sports Federation. In 2023, he's been director of the Olympian Association. In 2013, he became president of the association. In 2013, he's been director of the Japan Olympic Committee. And also, he's been head of the Japanese Swimming Association. In 2015, in October, he became the first commissioner of the sports agency when he was created. In April of 2017, he became director of the International Swimming Federation. So it's going to talk about Japan's initiative in terms of sports for all, sports in life. So with that, Mr. Suzuki. Thank you and hello to all of you. I'm very honored and grateful to be able to join Fiona-san for this very important conference. Also, I'd like to thank Mr. Aye, Mr. Fukashiro, and Raita-san, and also Inoue and Oguma-san, the president of the conference, as well the chair of this particular meeting. As you heard in the introduction, speaking about myself, I was an athlete. In 1984, in Los Angeles Olympic Games, I participated, and then the second time around in 1988 in the Seoul Olympic game, I was there. I was in the fourth year of the university, so I've been able to participate in the Olympic Games two times. But thereafter, I became an educator, a coach, and also a researcher. So I was involved in social activities. And thereafter, I headed the Swimming Association. And that gave us an opportunity. And I was instrumental in creating a swimming day in Japan. About 10,000 people die from not being able to swim in Japan. So we created this swimming day to prevent these accidents and also to send a message out that swimming is an interesting activity. And also we had an activity to strengthen swimming athletes in Japan so that the Japanese swimmers would be even stronger. When I was a swimmer myself, what I was keen about was to swim faster, to be stronger. But once I retired, I think I was more keen about contributing to society, to make the world and society better. I think I've been trying to work in that respect. And with that came opportunities to head the Swimming Association, and also for the Tokyo Olympic and the Paralympic activities. I was instrumental in the bidding of those games. And then 2015, I was selected to become the head of the sports agency. It's been 5 years in that capacity. Let me talk about the Japanese sort of government. As you see in the orange, in the bottom, this on the right, that's our association. And you have all the agencies, ministers, and there's a Ministry of Education, Culture, Sports, and Science, and Technology, and which is responsible for sports and education and everything else. And as part of that is Japan Sports Agency, and our sister agency is the Cultural Affairs Agency. And I'm sure the audience is interested in health. As far as health is concerned, there's a Ministry of Health and Welfare and Labor. And that's also an important core part of the organization. And I'll be coming back to that later. But let me talk about my agency, the sports agency. There are 7 divisions, as you see, highlighted in dark gray. There's a sports for health division is responsible for health in sports. And in terms of directionality of our policy, that's covered by our second sports basic plan that we have. So this plan gives us the direction that we are pursuing. And I'd like to show you our time schedule. Last year, there was a Rugby World Cup held in Japan. And from throughout the world, we had the visitors. And also inside Japan, it was a very popular game. The Japanese team was very active. So we had a huge success with this World Cup, thankfully. And with that, interest in sports also became very high and very enthusiastic. And then came 2020. We are hoping that there will boost in interest and enthusiasm about sports in Japan. But then we were faced with the COVID situation. So that sort of dampened the situation. But next year, the plan is for these games to be held. So towards that, preparing what we should be doing in order to make sure that these games will be held next year. All the agencies, including my own, working to prepare for that. And next year, in addition to the Tokyo Games, World Masters Games 2021 will be held not in Tokyo, but in Kansai area, that's Osaka. This is also a very large, huge games. It's more about sort of a lifetime sport, not just elite athlete sports. As long as you're willing to pay for participation, everyone can participate in these Masters Games. So after 2020, the idea is for the general public to participate in sports games. That's been our sort of a scenario, but the order had to be changed because of the COVID. But anyway, that's what's going to happen in 2021. Now, mentioned about this second sports basic plan, and we have 4 pillars through sports. Life will change is the idea. It will change people's lives, and also through sports, society can be changed, and also through sports, we can be connected to the world, and also we can create the future through sports. That's the idea, the 4 pillars of the basic plan. And in Japan, the population is about 100 million. The idea is the sports for everyone, all 100 million of them in Japan, so that they're motivated to do sports and to create a society where people are healthy in body and mind, and also can lead a cultural lifestyle throughout their lives, and also to enhance the value of sport to make sure that we can leave a legacy of this for the future of Japan. That's what is advocated in the basic plan. 5 years ago, sports agency was created. But how do we define sports? That's how we studied. When you hear the word sports, generally people think about competitive athletic sport games. That's probably the idea of so that that's it's not possible for me to be a sports person. That may be the general idea, but the etymology of sports repertoire, that's more a relaxation, a hobby. So not just for the professional athletes. The sports is there not for just the competitors, but for general public to walk, to dance, to do cycling. That's clearly, solidly a part of the sports definition. So in that way, we try to reduce and lower the hurdle to participate in sport activities. And also, not just for people to do sport, but also watch sports and also to support sports. those are ways of being engaged in sports initiatives, and that's how we are defining sports, playing and watching and supporting sports. We want to engage as many people as possible to make sure that sport idea become that much enlarged. And we also like to talk about the participation in sports. This year, looking at the Japanese adults, how active they are in terms of participation in sports, once a week or 3 times a week. And we have the graph by age, and starting in 1991, the latest is 2019 data. And those who do sports 1 day a week was about 27%. But since then, it has increased. At the time when the sports agency was created, it was about 42%. Now, about 53.6%. They play sports at least 1 day a week. So there's what's been up down, but it has been gradually rising. So this is the general figure, but we have some detail by age on the left. Sports participation for those in the 20-29 age bracket, they are not very active. And those in the 30s and 40s and 50s, they are not active, so that they are lowering the overall average. But those in the 70s, more than 70% of those are actually engaged in sports activities. Now, the graph on the right, why is it that people don't play sports? Well, people say they're too busy or it's bothersome, cumbersome. For those reasons, they don't play sports. If that's the reason, then we should eliminate those reasons. That's what we are going to do. So as you see, this is the action plan to increase percentage of people engaged in sports. And our target is children and youth, and also elderly people, women, as well as business people, and disabled people. So by different targets, the idea is to have policy to motivate them to and encourage them to do sports, or we will create measures necessary to play sports, and also to make sure that sports become a habit for them. Earlier, Ms. Fiona talked about the initiatives done by different countries, and I hope that you will remember what we are doing in Japan, this idea of sports in life. Sports to be part of people's lifestyle. That's what we are trying to advocate. Sport in life. Doing sports, playing sports should be part of your day or daily activity. And to make sure that a lot of people do this, so that society can become healthy, brighter, and more vibrant. Earlier, there was mentioned about the Olympics and Paralympics and legacy to be left. Last year, I think, we were talking about the legacy of the Tokyo Games. The interest, enthusiasm in sports were increasing. Therefore, people should be not just observer of sports, but a doer of sports as well. That idea should be the legacy of the Tokyo 2020 Games. And in the athlete committee of the organization committee, this lady is Naoko Takahashi, marathon runner. She has the initiative so that in 2020, yes, winning gold medals is important, but also people in general should be stimulated to do more sports. That should be the legacy of Tokyo. That's what sort of announced as a sport in life. Changing the topic a bit, this is how I commute. The sports agency is on the 13th floor of a building, and every morning I climb up the stairs to my office every morning. This is exactly an example that we are trying to show to the general public in Japan. Sports in life. we are too busy, so you cannot spend 1 or 2 hours in sport gyms. But as a part of your daily life, we could be active physically by walking or climbing upstairs. So including a sport activity in your life is how you can promote in sports in your life. And also before you work, you can do sports. So after your work, also sports can be enjoyed. There's an organization effort to make sure that people have more activity, the morning or evening sports activities. Earlier, Fiona-san talked about the environment conducive to sports activities. In Japan, swimming pools are open at 10 o'clock. The picture on the left is owned by the national government, so we can have the authority in changing. And now we're asking them to start 5 o'clock in the morning so that swimmers can enjoy swimming before they go to office. Unfortunately, it did not start at 5, but still 7 o'clock was the starting time. And with that, we're able to see a lot of people swimming early in the morning before they go to office work. That's probably a norm in the Western societies, but in Japan, environment conducive to people engaged more easily in sports was what we started.
And for business persons, of course, they are always busy. That is usually the case in Japan. That is one of the characteristics of the Japanese business people. But while they're commuting, they can get off the train one station before the destination station that they can walk, or during lunchtime, they could go to a restaurant a little bit far away from the office for enjoying lunch. So while they're working, they can start some physical activity or sports. That is one of the actions we are promoting in the policy. This is a Fun Plus Walk project. So you are working, but still you can enjoy walking, for example, with fun. This Fun Plus Walk project is not only adopted by the government offices, but also the companies. And for example, there's some shoemaker company or some other private companies, and this is a very big wave in Japan right now. Next, I would like to show you a video. This is the right-hand side. You can see a big doll. She is called Chiko-chan. This is very popular among all Japanese people. She dances with you, and particularly the women. We want to enhance the awareness of importance of physical activity among women. So we invited Chiko-chan to work with us. As for dancing, we are paying a lot of attention to it because it increases your heartbeat quite modestly. The dancing and the yoga would be very appropriate for women because they don't want to do the very vigorous sport. So we are now promoting this kind of sport or physical activity, showing how to dance. Of course, I'm not good at dancing, but I was one of the members in this video clip. Next. This is a mid-long-term measures to increase the participation rate. We are taking these 4 actions and measures. Creation of a regional sports environment. Well, as you know, there are so many big cities like Tokyo or some other local small villages, and we have to create a regional sports environment throughout Japan. And also we have to collaborate with sports-related organizations and also the medical care So not only the healthy people, but also the people with some diseases have to have an opportunity to enjoy sport and physical activity that will help the prevention of disease as well. And also we are promoting sports for people with disabilities as well. And also we want to promote the effort on evidence-based health and sport. And of course, we have to research overseas activities, and one of them is exercise is medicine. We are studying the activities abroad, and we are introducing some of those overseas activities to the Japanese people. In Japan, when a person goes to hospital for some disease and the doctor gives a lot of medication, that is a case, as usually the case. But now the sport could be one of the prescriptions to reduce the medical costs or to promote sport activities among the ordinary people. And along this line, as I said before, the health policy is under the responsibility of the Ministry of Health, Labor and Welfare. And since I took this office of commissioner, we asked them for us to help the health-related policies. So last year, I met the medical supervisor of the Ministry of Health, Labor and Welfare and asking for the collaboration. And I told them that we should not work for the ministry, but we should work for the general public by destroying the stereotype discrimination between the different ministries. So, some pictures are very small, but we decided to collaborate with the ministries so that we can promote the health sports related policies for the Japanese people in general. And this is the meeting with the Japan Council or Science Council of Japan. Many researchers are working in this Science Council of Japan. This is the top academic organization. And when we decide on the direction of some policies, we can ask them to submit some evidence, for example, as a reference material. And then we can ask some questions about our sports, and they could give us a feedback to us as answers so that we can have better policies. For example, e-sport, is it a sport? For example, is sport really good for health? These are the questions we raised to them. This is another picture with the Japan Medical Association. They have 170, 180,000 membership. Most of them are private practitioners, and we are collaborating with them as well. In order to create more healthy people, of course, we have to promote the moderate physical activity, and they made this kind of a recommendation to us. And we are in the sports industry, so we are promoting sport, but those medical people are, of course, in favor of sport, and they made a recommendation about the promotion of physical activity and in the PE. So we can promote sport more to our people. I think my time is running out, but this way, as I said before, this year we have a policy to collaborate with the medical care sector so that the people with the diseases can enjoy more sport. This is one of the policies we are promoting this year. Hospitals and the prefectural governments and sports facilities are the partners for us now so that everybody can enjoy sport. This is how the Japanese society should be. Now I will skip some of the slides from now because they're not so much related to today's topic. But Yes, there's many sport industry members are good at some points, and then we brought all of those advantages on one table, and we are trying to collaborate with those sports industry members so that we can create something new for the Japanese society as a solution. And the sports, of course, you use your body, so we have to be very careful about the medical condition. And then we have so many common points with the medical care sector. And then the technologies should be utilized as much as possible in our exercise. So we can collaborate with so many different industries, and we can work with them as a team so that we can find out the solution of our social problems. So what kind of sports are we talking about? Outdoor sports tourism. This is a sports in nature, or Budo tourism. This is a Japan-specific sport. We are promoting Budo. We are promoting Budo for particularly the inbound tourism, and then they have to be available throughout Japan. Next slide shows what kind of expectations overseas tourism have about the Japanese sport, sumo and also Budo. Budo, kendo, judo, karate, they're very much popular among the overseas tourists. And this one, yes, we are talking about COVID-19 as well. We are now with COVID, and then we have to think about how to use our money in the sports industry, because some Japanese people stopped sport activities or physical activities, and but we have to find out a way to keep the employment of sports industry as well. And of course, some people may have stopped the sports industry related businesses, but sometimes they want to resume the business. They need some financial support. And as step 3, then we have to support the interest raising. For example, some big conventions and games need some financial support, then we can give this kind of financial support. Then we are promoting this kind of measures. So I am coming to the end of my speech. The power of sports is very important. We are living in such an era, so we do need the power of sports. It gives us energy, and also it makes our life more enjoyable, and it helps us to make more friends. Sports are so useful, not only competitive sports, but also the extracurricular sports, and also the dancing while watching videos at home, or refreshing walking and cycling. All of them are recognized as all sports. So we should enjoy those sports in this new lifestyle. And this January, actually, I visited the WHO headquarters in Lausanne, and also I went to the IOC as well. I made an explanation about the legacy of Tokyo 2020 at the IOC, and the sport make people more healthy, not only the sport athletes, but also the people throughout the world. The sports is a very strong interest of all the people, and we want to make the sport as one of the legacies of Tokyo 2020. And then after that, I visited the WHO headquarters, and this made the same kind of explanation. Naoko Yamamoto, person right next to me, and so not only as a legacy of Tokyo 2020, through the collaboration between the WHO and IOC, we should promote that more sport would make people happier. And we asked for the cooperation and collaboration from the WHO for that purpose. And this is a new national stadium, Japan National Stadium. Next year, I would very much like to welcome you at this national stadium. This Tokyo 2020 will be held next year. It is so scheduled. We have to combat against COVID-19. And as a sign of our conquer of the COVID-19, we want to celebrate the Tokyo 2020. And we want to share the joy of the conquest through sport. So sports can change and sports can create the future. This is my message. Thank you very much for your kind attention.
Thank you, Commissioner Suzuki. Thank you for the very powerful, enthusiastic presentation. And in your speech, you said that you were an Olympian athlete based on the experience. However, you became an educator, and now you are head of the sports agency. As part of the second basic plan, you defined the sports. Sports in life is now what you are advocating. Sports as a legacy, so that every one of the Japanese population will be involved in sports engagement. So that's sports for Japan. Now, Fiona-san earlier talked about physical activity. I think there's strong affinity between the two words, sports versus physical activity. In the mid-long-term plan, you have more concrete ideas of promoting people working before going to the office early in the morning and in the evening. You had the dance video with the Chiko-chan. You also talked about the opportunity for sports to be enjoyed by people with the physical and other conditions. And also, you talked about the budget allocation in the midst of the COVID situation. Sports has got a power, and everybody should be able to enjoy sports in safety. And thank you for all those messages in your presentation. Now, at this point, see the screen, all of us, and also Fiona-san is on the screen. So in the second half of the program, it's going to be a dialogue between the two speakers. We have actually received some questions from the participants prior to before today, but to make sure this is a bi-directional discussion, dialogue between the participants. First of all, so this is for the two speakers. If you have questions relative to the presentations of each speakers, I'd like to ask you to raise questions. Fiona-san, do you have any question of Mr. Suzuki's presentation?
Thank you very much. First of all, may I congratulate and thank for an excellent presentation and an inspiring presentation with so much of it resonating the work of Japan, aligning with creating sport as part of every day. And your examples were wonderful, and I will use these examples. I wonder, Dr. Suzuki, if you could share with us how these initiatives are being implemented across the prefectures, across Japan. We need to learn from Japan with such a large population. How do you ensure it's reaching the furthest corners of Japan and reaching everyone?
Thank you for that question. Japan, it's got 47 prefectures, and by region, there is a difference, I might say. Particularly, Tokyo is a huge city, like New York. So Tokyo is like New York, but in provincial areas, regions, And the public transportation system is lacking, or some transportation system has been suspended, stopped. So mobility is lacking. People have to depend on driving cars in those remote areas. In other words, people don't walk. Actually, the number of people not walking is increasing in those regional areas. And those are the areas where people are older, elderly people. They should be encouraged to do sports. That's what we should be doing, I think. As you know, our country, in terms of healthy lives, they say that after you fall sick, people still live for 10 years, not very healthy. And during that time, the medical cost continues to just increase. Therefore, we want to encourage people, elderly, particularly in provincial areas, to do sports so that they are more healthy, reducing medical cost. And Japan is long north to south. And your question is very much relevant, but maybe pointing to the difference, not being able to reach everyone in Japan. That's indeed a challenge. Your point was very much to the point. Thank you very much.
Thank you very much. Yes, there are some discrepancies between the big cities and the local areas, and we have to bridge the gaps. And so, do you have any question? Yes, to you. Thank you very much for your so many slides. They are so informative. I learned a lot from your slides, and we have some data about Japan. But today, you showed us the position of Japan in the world that is very helpful in terms of the physical activity and the sport. Thank you so much. And I have a question. I have an interest in the following point. By region, you showed the degree or percentage of the physical activity and the sport. And some of the countries are successful. I mean, some of the areas whose physical inactivity is decreasing. For example, Oceania. Do you know they did something special? Some special policy to be successful? Why did they reduce the physical inactivity percentage? Could you tell me if you can?
Yes, thank you. And thank you very much. And thank you for looking at the data so closely. Oceania is of interest. This is comprising the West Pacific Islands in particular. And we think the effort that has been made in those island nations with their concern of obesity, their concern of rising levels of diabetes, they have made extra effort with some leadership in the area of physical activity and sport. I know, for example, in Fiji, they are using sport, and in particular rugby, to mobilize children and the community. So we think their efforts are visible in these data. We also see in one or two other regions where there is a large mega country, they often drive that regional estimate. And we do see in China making an influence, and they have a signal of some positive change as they have created more environments with cycling, cycle share schemes and others. We look to verify and understand exactly what they're doing, but as such a large country, it drives that estimate. But conversely, in India, which drives a different estimate, we are seeing the reverse. Despite the same issues of obesity, diabetes, chronic disease, only recently, and we're very pleased to see Fit India, the new initiative under the Prime Minister and the Ministry of Sport. And this is very interesting and speaks to your point, Dr. Suzuki, how sometimes it is the Ministry of Sport and the sport agency that is providing that leadership and bringing the parties together. In some countries, it's the Ministry of Health, but again, in India, it is the sport. So we have signals, and one issue I think we share is learning more from where countries have put in place these whole programs. And I encourage Japan to ensure you continue to monitor and be able to disaggregate your data by gender and age and prefecture, so you can track your progress, because WHO has identified a lack of whole system national approaches. We hear about small studies, individual components, but your question of me, and I get very often, is show me the countries and the evidence of a national approach. And I invite us to continue to discuss how can we capture those case studies, because that's the powerful example. Let us match with sport the sort of evidence we've seen in tobacco, where they can say we did this, 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 and we can see the data. And it's that powerful evidence with the economic case that we need to bring together. And I think it's a little too weak for physical activity and sport. We have a strong argument, but we need more evidence.
Thank you. Thank you very much. So, gathering and collecting more evidence, that's important. And in Japan, when policy decision making is made in Japan, to obtain more budget among different ministries to promote health administration, yes, there's always talk of, do we have evidence to ask for more budget? So sports, physical activities, and their impact on health. I mean, that's the global sort of agenda. So all countries have initiatives programs. What I would like to ask is that we could share the initiatives and data that we have so that we can gather evidence so that we can tell people that physical activities is so good for the health. It should be the world, the global initiative. The world should emphasize that importance so that we can get more budget. And that's sports, but pursuing good health, that idea, I mean, it applies to any country of the world. We should all pursue that. We are suffering climate change and environmental issues. That's different from one country to the next, but as far as health is concerned, it's an agenda the same for all countries, each and every one of us. So there we can coordinate, collaborate. Fiona-san and WHO, I would like to see your even stronger leadership. We will be there to help and cooperate with you as much as possible so that we can promote the health and welfare of the entire world. So that's one sort of request I'd like to make of you. Thank you. Fiona-san, do you have any comment for that?
No, I thank the invitation to work together, and learning from the work of Japan and bringing this idea of more evidence through collaboration is very important. And the voice of Japan and the leadership around the Tokyo Olympics and the IOC is a very powerful partnership. I look forward to that and we'll follow up. Thank you.
Thank you very much. It should be a collaborative effort globally. Whole program. It should be holistic. The wholeness is important. The leadership should be in that way. The sports industry should be there to take that initiative for the entire Japan. And also, borrowing the words of Hiwana-san, evidence from Japan, Japan's power, I think expectations are based on what Japan can contribute. In India, India is now a sports agency. I think it will be a center of global attention going forward. So thank you for that. I would like to change the topic for now. We have received questions earlier about the COVID-19. Many questions were about COVID-19, for instance, about the impact on children or school activities or extracurricular activities, and also for the elderly. They are vulnerable, they are confined to staying at home, and we have so many questions, but We don't have time to throw all those questions, but just summarizing some of those questions. This one is for you, Fiona-san. As far as WHO is concerned, actually, I think you had a slide on risk assessment tool, the need for the risk assessment tool. But in the long run, long term, what is WHO's view about the sports and physical activities beyond and after the COVID-19? In the aftermath of it.
Thank you for the question. We have developed and are supporting sport international federations through the IOC, of course, the Olympics, and indeed the sports industry, the fitness clubs and gyms and swimming pools, to have a risk assessment and preparedness strategy for reopening according to the local conditions and national guidance and requirements. These are available on the website. We know many sporting international and national associations are using these. Of course, we need to hear feedback, and we need good compliance by both the sports players. Obviously, at the moment, much sport is really with no spectators. It's opening up an opportunity for more digital, a larger audience in some ways, but it's virtual audience. We, of course, have got a long-term picture to support the opportunities to be active and the importance of being active to recover. And we would like to see that those who've been engaged through physical activity virtually can then take that and continue. So I view that COVID means we have to double up our work on physical activity, working through COVID sensibly, safely, and good evidence. But we then need to see and support the communities recover. The importance of physical activity for mental health, for example, to address the loneliness. And you mentioned in your presentation, Dr. Suzuki, the aging population. I was struck by your barriers, which said that not only too busy, but those who felt they were too old, that had no friends, that had no space. In total, that was another 30 or 40%, and there may be some double counting. But these are powerful things. And as you said, we must address. Through physical activity, you can bring friendships and connect, whether that's virtual or in person. And I think COVID has actually created innovation in bringing physical activity opportunities, more affordable, if not free, approaches to our living rooms. I think we can continue many of these. I'm worried about children. I think the missing of physical education and opportunities through interactive sport and play may be damaging in the longer term. And so we must work with our education sector to ensure that it does come back and continue, and make sure grassroots sports teams and clubs and the swimming pools are still full of people safely being active. So I'm optimistic, but we have to slowly work through the changing environment over the next 6 to 12 to 18 months until we see, and let's come out better on the other side. Thank you for the question.
Thank you very much. Yes, thank you very much for your message for our future long-term reality. Mr. Suzuki, about Japan. Well, in Japan, in April, the government issued the state of emergency, and the people had to refrain from going for unnecessary purposes, and also the schools were closed, and the sport athletes cannot exercise any longer. And what happened? The athletes cannot exercise, as you can understand, as you can imagine. the ordinary people and the children lost their energy and then the level of strength, and also some people gained weight, for example. There were so many effects, mental effect as well. At first, people had to stay home, and then we want to keep staying home so that we can combat against the COVID-19 as soon as possible, but still it is with us. So we have to think about how we can enjoy our life with COVID-19. For example, we have to wear masks, we have to practice social distancing, and we have to still enjoy the physical activity. In summer, as you know, Japanese summer is very hot and humid. So we were advised not to wear masks outside to do some physical activity in summer. And then we promoted to do some physical activity in this COVID-19 era. But the COVID-19 is still with us, but some schools started their classes, and then people started to enjoy sports safely and securely, and some people started to enjoy an ordinary life, taking countermeasures against the COVID-19. So the sports and then the measures against the COVID-19 have to be the two wheels working together. Next year, we are scheduling a very big game, so we have to send a message. Japan is safe and secure to the overseas people, so that we can realize these scheduled games. But still, people are suffering from the lack of exercise. So some people are suffering from the secondary effect of COVID-19, as well as the infection of COVID-19. Now we are now living in a globalized society, a globalized world. So it is difficult to live without isolation. And another example about Japan. Now we are living with COVID-19, and Tokyo is such a big country, but its population is decreasing for the last few months. Because in Tokyo, we cannot avoid being very close to other people. So some people started to shift back to their hometowns in regions or local areas. So the social distancing in Tokyo or in other big cities is quite difficult. And as I previously I said, the population in the rural area is decreasing, but because of the COVID-19, some people started to move to the rural areas. So you said the COVID-19 would create a new society, and we started to see this kind of a new phenomena that would change our society. So we have to look at the positive side of the COVID-19. We shouldn't be so pessimistic about the COVID-19, and we have to find out something new, something bright side of the COVID-19 for our society and for our environment. Then we have to change some of the policies and actions in that way. Of course, well, in general, rural areas have less population, so it's more advantageous for us to enjoy sports outside in rural areas rather than the urban areas. This is one of the messages I wanted to convey to you. Thank you very much. Yes, COVID could be a trigger to look at the positive side or to create a new society. In the long run, well, of course, we need some manpower. It might bring some positive side to our society. That could be another legacy of this society, not only for Japan, but for the world as well. There are so many questions raised and so many points that I want to ask to you, to speakers, but we are running out of time. But I want to raise a question from the audience. This is related to one of the slides of the Fiona. You said about 30% of the people are physically inactive. What was the recommended rate?
Thank you very much.
Wait a moment. Moderate. Moderate.
週に150分早足歩きをするぐらい合計でですね、それくらいのレベルがWHO が出している
WHO's recommendation is moderate walking about 150 minutes per week. But I want to ask Fiona about the physical inactivity, but it's already
質問もたくさん寄せられております。
Yes,
so
so
we
you are
received
correct.
so many questions.
はい、Thank you.
Very briefly, you are correct that the recommendation is for all adults to do 150 minutes of moderate intensity activity a week. Of course, this could be through vigorous, and then it's slightly less, 75 minutes. But I want to emphasize that more is better. So this is the lowest level, but we do know substantial health benefits from that modest level. And 30% do not reach that level. For children, it is 1 hour. And so 1 hour a day, it is more. And we understand there are very important growth, development, social, motor skills for all the reasons. There is a recommendation for more activity for children. And we now will be updating that evidence, but I can forecast the guidelines don't change that much. We're only reinforcing those numbers with some new elements, which you will read in November. Thank you.
ありがとうございます。はい、11月にリリースされるのを
Thank you.
楽しみにしております。
Yes, we're looking forward to the new release in November. I think we've had an excellent opportunity today.
日本からの発信、そして世界が
Japan is sending a message that the world should cooperate to promote sports and physical activities. I think we've been able to share this message today. There's a lot that we would like to have been able to cover today, but at this point, we would like to close this open public seminar. But we make sure to review all the questions received so that your interest, people's interest can be reflected in the policy going forward. If there is a closing message from Dr. Inoue. Yes, thank you, Commissioner Suzuki and Fiona-san. Thank you very much for those encouraging messages. As far as the COVID-19 is concerned, we should take this as an opportunity, a chance. Yes, we are facing difficulties, but Fiona-san said, and she used the words such as challenges. But the thing is that there's an increasing level of interest in sports. If you look at the Google numbers, that's what's happening. And so collaboration is an important agenda for WHO. And sport agency is doing a very much a good job. And we are, I myself am a researcher, and a lot of researchers are, I think, listening to this program, and I would like to be there to be part of that collaboration so that we can create a society where everyone can enjoy sports. Promotion of sports is the purpose that we've joined today, and I'd like to thank you very much for your participation, and this concludes our proceedings today. Thank you.